न्यूज़ 18 में आपका खैर मकदम। मैं हूँ आपका मेज़बान यहिया सुल्तान और आज हमारे साथ एक ख़ास शख्सियत हैं, यानी कि फॉर्मर हमारे डायरेक्टर जो स्किम्स थे और उसके साथ ही बैनुल अक़वामी सतह के मुआलिज डॉक्टर खuroo साहब हैं। डॉक्टर खuroo साहब, न्यूज़ 18 में आपका खैर मकदम। एक मैसेज मैं आपसे जानना चाहता हूँ ताकि पूरी डॉक्टर्स कम्युनिटी के लिए, कि हमने देखा कि जब आप प्रैक्टिस कर रहे थे आपने ख़ुद भी कहा है कि मैं 20 मिनट नए पेशेंट को दे देता, 10 मिनट उस पेशेंट को जो पहले रूटीन में आता था। आज के डेट में कहीं न कहीं वो लैक हो रहा है। हमारे मरीज़ अक्सर बेशतर शिकायत कर रहे हैं कि डॉक्टर सही तरीके से ट्रीटमेंट नहीं कर पा रहे हैं। ये इल्ज़ाम है लोगों का डॉक्टरी तबके की तरफ। तो आप ख़ास मैसेज क्या रहेगी ख़ास तौर पर इस फैटर्निटी की तरफ से?
मैंने ये जो हेल्थ केयर जो पेशेंट केयर है, दैट इज़ द पेशेंट केयर, it has to have its norms. That means whenever a patient comes to you, first you should be available to see him and you should have a committed time for the patient. That's number one. Second, you are not treating a disease of the patient, you are treating a human being. So you have to know everything about him, his past records, his health, what happened to him in the past, what drugs he is taking, what do the other doctors say about him, and also take the whole view and then interview him. Not only interview him, interview his his caregiver. That is maybe his husband, maybe his wife, maybe his brother, maybe his sister, जो भी उसके साथ हो. Interview him also and know also his psychological status. So you are treating a human being who has a disease, who is in pain. And if you don't have time to listen and know all that, you're not doing a patient care. And after that, when you do that, you have to have time to talk to him and counsel him, what's called counseling. You can never treat a patient unless you counsel him. Counsel means that you tell him everything about his disease and everything about his treatment and how he has to follow in the future. And then the last part, after you do all that, you have to be available to him for what's called a continuity of care. जैसे लोग आते हैं, दिल्ली से आते हैं, एक दफ़ा आया तो दूसरे वो 3 महीने या 4 महीने के बाद आएगा. That's not health care, that's not patient care. Patient care is that you see this patient, you get his investigation, you do it, next 3 days, be available to him. And then tell him, okay, you come after 6 weeks, 2 months, 1 month, you should be available to him. So continuity of care is essential in patient care. So in patient care, you treat a patient, not disease. You treat a human being and you treat him, his family, and you know about everything about him. For this, you need time. You need patience. You need to know, listen to the person. Ask him to question you and you have to answer his questions. Maybe sometimes some patients come and they do, I tell them, okay, this is treatment, this is your counsel. They yet want to continue and talking to me because they have their questions. Never get disturbed. Have patience. Listen to him because some people come with such apprehensions. The patient comes with the apprehension, oh, this is going to happen, this is going to happen. What will I do to my family? I may die, I may get disease, which is just you have to counsel him and give the correct statement. Many times, what happens, a patient has a serious disease, so we can't tell him. Then you secretly call his immediate health care giver, maybe his wife, whatever, whoever is taking care of him, and tell him the real story so that the whole family is ready to face the disease of the patient and that human being's pain. You have to also, very important thing in patient care is what called empathy. Empathy means by definition, it's a very important term, that you put yourself in the patient's position and see what will happen to me. Now this patient has cancer. What will happen to me, God forbid, if I get cancer? How will I deal? How will I deal with myself, with my family, with my bank accounts, with my money, with my whatever it is. So this is called empathy. So you have to have an empathy while doing patient care. So for this, time, patience, wisdom, and you have to have tolerance. That would be empathy. Once you do that, that is patient care. Patient care is not that you make a line of 10 people and make them walk through a corridor and just write prescriptions. That's not patient care. That's
राइट
certain.
मिलना चाहिए पेशेंट को, उसका है फंडामेंटल राइट.
It is his right to what I told you.
Yes, sir.
This is the patient's right. And for that you need time. Many people say, oh, please see my patient today. I tell them I can't see it. They get very disturbed. I'll tell you an interesting story. A very important people came to my clinic one day and he said, I won't see you. The receptionist told him, you can't, Dr. Khuroo cannot see you. Told him why. He said, he has already got so many patients. He needs another 45 minutes, half an hour. He doesn't have that. He is busy up to the... So he got very disturbed. But he got an appointment next day. Then he came next day. I sat with him. Now this gentleman was a very important officer and he had a coronary artery disease, he had a stent and he was an aspirin. And he had gone to another very important doctor. He went after me, he saw a doctor. He wrote a prescription in the corridor.
Oh.
In the hospital corridor, he wrote prescription. Wrote prescription, which if he had the drug he had taken, he would have died. Because he had never asked him, what is your story that he had a stent in the heart? And this stent would have got blocked. So, this is one, I give you thousands of examples like that.
यहाँ पर जो क्वालिटी हेल्थ केयर है उसके बाद आपका तो इनॉग्रेशन हुआ और वो आपका स्टूडेंट भी रहा है, ये क्या कहेंगे?
मैं ऐसे बोलूँ कि कुपवारा और हंदवारा और द्रगुला में आता रहता हूँ बचपन से ही, पर आज मैं ये क्वालिटी हेल्थ केयर जो डॉक्टर मजीद वानी ने यहाँ बनाया है द्रगुला में, ये तो एक मुबारक बात है उसको देने के लिए कि उसने इस जगह इतने दूर इतनी हाई क्वालिटी ये हॉस्पिटल बनाया. हमने देख लिया हॉस्पिटल, इसका इंस्पेक्शन भी किया, इसके थिएटर्स, वार्ड्स और सब स्ट्रक्चर के. इट इज़ क्वालिटी, रियल क्वालिटी, हाई क्वालिटी हॉस्पिटल नंबर वन. एंड टू डू इट इन दिस प्लेस इतने दूर से, तो ये तो मुबारक बात है. दूसरा, आज का ये जो मौका है कि इसने NABL जो सर्टिफिकेशन लाई है, एक्रेडिटेशन, ये उस सेंटर को मिलती है और उस इंस्टीट्यूशन को मिलती है जो क्वालिटी केयर में कंप्लीट परफेक्ट हो. क्वालिटी केयर हो गया, जो बिल्डिंग बनाई आपने उसकी बिल्डिंग की सेफ्टी, उसकी whether it is safe for fire, it is safe for earthquake, number one, and how the patients are received, how the patients are managed, and how the patients are treated, and what is the safety to the patient, and what is the quality of care. All this matters. Once this gets perfected, and once this is in excellent shape, then you get a national NABL or ये जो एक्रेडिटेशन है फिर मिल जाती. तो इसलिए मैं मजीद साहब को मुबारकबाद देना चाहता हूँ कि इसके जो ये हॉस्पिटल है ये एक्रेडिट हुआ है एज ए नेशनल, एट द नेशनल लेवल, एंड दैट पेशेंट जो आते हैं इट इज़ सेफ फॉर देम एंड दे विल गेट a good, not only good, excellent health care. So to do that in a place like this, I think it's something wonderful. And I'm so happy that I knew Majid Saab as a student, as a resident, and I have had some contribution in his training, but he himself has been a student who has been extremely hardworking, very, very intelligent, and who always thought of the quality and always thought of the society. And probably that's why you say he left everything in his life. He could have been in Saudi Arabia, he could have been in any other part of the J&K or even India. He made this place with all the hard work in his home place, in his hometown, and it's something